Welcome back to Wellness Wisdom. Today we're going to be talking about multiple sclerosis. And before we get into it, I want to give you a little top contour about what is MS. So it's basically a disease in which your nerve fibers become damaged. And this process is chronic. We don't really have a cure for it. And it essentially works, not to get too in depth, but your immune system, so you have C and T cells, B cells, these cells will attack your myelin sheath. And so this is essentially like a electrical wire, if you could think about this analogy. So you have insulation around your electrical wire, and your immune system will eat away at that electrical wire. And if that were to happen in your cables that you use every day, the conduction would be interrupted. So you can think about trying to, lift a pin up off the ground. Your electrical signals that go from your brain to your muscles would be damaged and less likely to perform at top function. So this is why in MS, your conduction becomes spottier and impaired. And this is unfortunate because MS, it affects a lot of people. So I guess almost over 1 million people in the United States in 2019 were found to have some degree of multiple sclerosis. And in order to be diagnosed with this illness, you have to meet a few criteria. And it's more common in women, almost 2 times more likely. And it's usually found in people who are of age of like 20 to 50. So like right in the middle of, when you're child rearing and in the middle of your career, which might be associated to stress, because we'll get into why that might be a little bit later. But to be diagnosed, you need to have a few things. So you need evidence of 2 lesions. And what a lesion is a it's a fancy word for a blob or a damaged tissue that shows up on an MRI. So the reason this is the case, because if you only have one lesion, which would be one damaged portion of your myelin sheath or your nervous system, that would be considered clinical or clinically isolated syndrome, CIS. And this is when you only have one episode of symptoms that last at least 24 hours. And if properly treated, it's possible that CIS could be prevented from developing into formal MS. But it's important. That's why it's important to consult with your physician to see which intervention is best. And yeah, MS has been historically poorly treated with medications that don't really work very well. But recently we have immunomodulators. So this is basically just drugs that can impact how our immune system is attacking our own nervous system. So in the case of MS, we can take drugs to calm down our immune system and prevent new lesions from occurring. So that's something you should speak with your physician about if you're having that issue. And yeah, the MRI will also show inflammation, and that's due to a couple of factors. Like if you're in a flare or a relapse, you're going to have a lot of inflammation, and that can lead to like the breakdown of the blood brain barrier, and that creates a cascade of issues. And it's also been shown that brain atrophy, which is a normal part of aging, occurs twice as rapidly in patients with MS. So yeah, so that's the top contour of MS, but also how does MS break down? So the main type of MS is RRMS, or relapsing remitting MS. And so this is where you have a relapse and you detect a lesion from your physician, and then you have a brief stability or remission. That's typically you're doing worse than you were before the lesion, obviously, but it's not progressing until the next lesion. And that can progress into secondary progressive MS, which is essentially just it's a progression of relapse and remitting, except you won't have more lesions. It just gets worse progressively. And then primary progressive is skipping the relapse and remitting phase. And that's where you just start out with a lesion and then you get worse without new lesions or phase of stability. So, yeah, so what is a relapse if we could define it? It's basically just new MS symptoms that last 24 hours or more. And it would have to be 30 days in between the last relapse to be official. And if not, it's considered a pseudo-relapse. And this is worsening of symptoms during a period of remission. And usually it can be triggered by heat, stress, or infections. And if you think about why that is, because your immune system is the problem here. So if you are overheated, if you're stressed out by work, or if you have a UTI or a urinary tract infection or a virus, then your immune system is going to be kicked up into hyperdrive, and those cells that are normal in a typical person can be pathological and damage that myelin sheath in the MS patient. So that's a little bit about the why of MS. So that's why it happens, but why do we care? So the symptoms of MS are fatigue. So this can present as like loss of physical and mental energy. And most patients with MS report this as being the worst symptom they experience because it can cause unemployment. If you can imagine working a 9 to 5 with a chronic disease that prevents you from moving efficiently in your motor neurons because they're damaged, and like central drive can be reduced. So your brain produces signals to your muscles, say like, hey, let's go walk over there, go to the coffee machine. In MS, your motor neurons might be so damaged that that thought process, in order to conduct that signal, it's an immense task for the worker. So it's no surprise that many people choose to go on unemployment with MS, and then delineating what we can do about it, right? Like keeping a fatigue journal and like just keeping note of how you're feeling every day. So using a RPE scale, which is a rating of perceived exertion. So 0 being at rest, sleeping, laying in bed, 10 being the most intense exertion that you could imagine. So this will allow you to analyze your history of days. So on days that you've been doing well, what were you doing in those days that allowed you to be so successful? So short, frequent breaks in between tasks, planning ahead, sleeping well, eating well. A fatigue journal can help improve future performance, essentially. Other symptoms of MS are numbness and tingling, and we call this paresthesia. So if you feel pins and needles, numbness, and even reduced sensation, this is because your MS does not really discriminate against nerves. So any nerve conduction can be interrupted because it will attack any myelin sheath. So if you can imagine even your optic tract being impacted, so this could lead to an optic nerve lesion, which your optic nerve is how you see, so it can lead to blindness. Also memory loss, because the lesions can also be in the brain. You can have physical therapy related like foot drop, and so foot drop is due to muscle weakness. But when you think about muscle weakness, we typically think, well, the muscle's not, it's too small to produce enough force. But in the case of MS, it's actually the nerve controlling the muscle is losing its conduction because of the MS progression. So that's just something that's atypical, and why it's important that we treat it. Range of motion. So range of motion is essentially if you could bend your elbow and extend your elbow, straighten it, that's the full range of motion. And if you're losing conduction or control over your joints, then you can develop what's called a contracture, which is a severe limitation of your ability to control that range of motion fully. So this is an issue because to do functional tasks like walking, sitting, reaching overhead, they all require a certain amount of range of motion. And a contracture can pretty much reduce your quality of life. And that's something that physical therapy can help address, because if you're reduced in range of motion, you're not really living the best you can. Coordination can also be slow, awkward, or unsteady, because if you have to think about controlling each individual finger when you're picking something up, that can create another quality of life issue. And then we also have spasticity. And this is a confusing concept for a lot of people. Spasticity is, it can be low tone or it can be high tone. And the best way to think about this is if you're going to bend your bicep, the main mover, or if you're going to bend your arm, your bicep is the agonist or the main muscle that's going to move the joint. And if you're high tone, then your tricep, which would be your antagonist, which is slowing down, or it's like it's controlling the bending of your elbow. In a very high tone individual, like someone with MS might be, when they go to bend their arm, their tricep will also activate almost as intensely as their bicep. So that means they're simultaneously bending their arm but extending their arm. So that leads to inefficiencies. It can actually be positive in some cases because it might make them more stable depending on the joint. But this is also something that a physical therapist could help a patient with MS with. And then another symptom of MS is heat sensitivity. So MS symptoms might worsen in heat. So like they might avoid hot baths, exercising like outside on a hot day. This can cause just immense weakness and disability. So it's just something to keep in mind. There's also UTOF's phenomenon, which is basically worsening of MS symptoms if you are overheated. So symptoms should alleviate when the core temperature returns to normal. So this is why people with MS might choose to have like cold water around them. They might take frequent rest breaks. And if you're unsure if it's a true relapse or a pseudo relapse or UTOF's phenomenon, see a physician immediately, because if you do develop a new lesion, it's important you get treatment for that by a healthcare professional. And there's also pain. So there's Lermite's sign, which is with neck flexion or bringing your chin to your chest. You will feel a shooting of pain in the back of your neck and back. It's just it's a cluster of symptoms that an MS patient might feel. MS can also impact mental health, depression, cognition. So yeah, what can we do to prevent MS? So we can reduce the risk factors of developing MS. So the biggest of those might be tobacco exposure. So it's been shown that smokers have a 2 times increased risk of progressing to multiple sclerosis. Smokers who do develop MS develop a more aggressive version, which does not sound very, we wouldn't want that. So reducing your exposure to smoke and tobacco. And the next issue we have would be just getting any infection. So the Epstein-Barr virus, so that's could be any infection really. It can increase risk of MS 2 times. So this is because your CD4 T cells, your CD8, your immune response to a viral infection might kickstart the immune system damaging itself. At least that's the hypothesis. We also have vitamin D. So vitamin D deficiency, which you can absorb naturally from the sun, is correlated with increased risk of MS development. So if you are deficient with vitamin D, the only way you would know that is if you get a blood panel done from a physician. You might be inclined to supplement with vitamin D3, and that can also do many other beautiful things for you other than reducing the risk of MS. But we also have cardiovascular risk factors. So high blood pressure, high cholesterol, and diabetes are all like very common comorbidities to multiple sclerosis. So by addressing things like BMI, which is your body mass index, so those who have too much visceral fat around their organs can lead to high cholesterol. It can lead to poor glucose use when you eat a piece of cake or something. Your glucose will just circulate, and then you won't be able to use that glucose, and that can cause diabetes. High blood pressure can be treated with aerobic exercise and certain medications. And lastly, we have nutrition. So going back to the role of inflammation in multiple sclerosis, so diet can be a modulator of how much inflammation your body is being exposed to. So your gut-brain axis is dependent on your gut composition. So what we eat is like what we become, funny enough. So like vitamins, fatty acids, amino acids directly impact how we feel in our brain and also how our immune system is functioning. So it's been shown the Paleolithic diet and many other diets. I'm not, going to be on a soapbox for any particular diet, but on the MS website, and even the American Heart Association recommends diets that are low in processed foods and plentiful in fruit and veggies, have been shown to be, good for any low inflammatory lifestyle. So removing processed foods and adding in whole foods could be a way to reduce your risk of developing MS. So can MS be treated? After a relapse, it's very important to go to a hospital and get treatment with medication. As I said before, medications have gotten a lot better in recent years. And if you are getting new lesions, it's important to get with a competent doctor who can get you on a medication to prevent new lesions, because it's really unexcusable to develop a new lesion if you're actively getting treatment, because we have so many beautiful drugs that can help us. And we also have ways to manage MS. And I'm a student physical therapist, so I'd like to talk to you about some of the interventions we can do for physical therapy to maintain independence and increase the health span of a patient with MS. So say your primary impairment, like weakness, which would prevent you from activating your muscles to allow for strength or your activities of daily living. So you can look at this in two ways. Part of it is going to be a primary impairment that's due to the nervous system being unable to conduct a conduction signal to the muscle to say, hey, we want to go kick this ball. A secondary impairment is due to the primary impairment. So if you develop MS and it's harder for you to do things because you're fatigued, that's going to lead to overall systemic fatigue. It's going to lead to secondary contractures to the primary impairment of multiple sclerosis. So a physical therapist is a movement expert who can address all of the movement dysfunctions, focusing on the primary and secondary impairments. So circuit training has been shown to be very effective for patients with MS. And basically what that is it's multiple systems being trained simultaneously. So that could be balance training on a Bosu ball with a physical therapist throwing up the ball to the patient. It could be heel walking, working on gait, could be squats, hypertrophy, strength. It can be calf raises. It can be aerobic exercise, all in one circuit. And then you would rest and repeat for X number of repetitions. So that's important because if you're not really moving, your secondary impairments like atrophy are going to make you very dependent on your caregivers. So what can we do for exercise? Aerobic exercise can be done biking, like swimming, walking, even arm bikes. And if muscular weakness is preventing you from getting your cardiovascular exercise, that would mean like if you're walking or running and that causes a breakdown in form and a risk of falling, you should consider like biking or arm cycling as an alternative to allow your heart rate to be sufficiently elevated to get the benefits of aerobic exercise. Because if you're walking, it's great. If you look at the literature, I think 6,000 to 8,000 steps per day can reduce all-cause mortality. But aerobic exercise, you want to elevate your heart rate for about 30 minutes for 3 to 5 days a week. And for the MS patient, you need to make sure to not overheat. So maybe doing it indoors, keeping cool towels and ice water available so that you're not flaring up your symptoms, because we would not want that. Strength training can be done with resistance exercise, and this is focusing on full body workouts, focusing on doing compound exercises like push-ups, cable rows, and sit-to-stands. And what a compound exercise is the opposite of an isolation exercise. So an isolation exercise would be like a bicep curl, which you're only using a very select few muscles and focusing on isolating your bicep to grow in size and strength. But what a compound exercise would be like a bodyweight squat or a deadlift. And I particularly like these for anybody, not just those with MS, is because you get a lot of bang for your buck. So you get to hit almost every muscle in your body. If you're doing a push-up, you get core stability, you get all the pressing muscles all at the same time. So focusing on compound exercises for 8 to 15 reps, and your intensity should be about 68% of your 1 rep maximum. So focusing on your weak points, right? So if you have foot drop, which might cause you to drag your toes on the ground when you're walking, training anterior tibialis, which is the muscle right in front of your tibia or your lower leg, that can help increase the strength of your ability to perform that movement. However, if it's not necessarily a strength deficit, a physical therapist can be used to integrate correct motor control in a functional setting. So we can do what's called gait training, which is focusing on actually improving the quality of your walking so that it's safe, it's effective, it's efficient, so you can go back and do what you need to do in the real world. Core strengthening is important for anybody. So I would say you would need to learn how to brace your transversus abdominis, which is your deep core. And you can do this lying down, learning to contract or draw in your stomach for 10 seconds with an isometric hold. And you can also learn this by doing diaphragmatic breathing. So you would be on your back or in sitting. One hand is over your chest, one hand is over your stomach. You're going to smell the roses, so take a deep breath through your nose and then blow out the candles with your mouth. And you want to feel the movement coming from your stomach, not your chest. A little bit of chest movement is normal, but most of the movement should be driving through that stomach. And this is to ensure you're using your diaphragm. And once you get your transverse abdominis ready to rock and roll, you can also learn how to keep a neutral pelvis. And you can do this on the ground or on your bed. So this is important because you need to keep your lower back touching the floor because if you have an arched or lordotic curve in your lower back, this means you're an anterior tilt and you're unable to contract your core. So once you master keeping a neutral pelvis by contracting your core and keeping your lower back flat against the ground, you can advance to things like dead bugs. So this is a functional or dynamic movement where you can train multiple muscles, multiple movement coordination abilities at the same time. So we can also do things, we were talking about improving gait training. So over half of MS patients have fallen within the last half of a year. So that's unfortunate because falling can be deadly, especially as we age. And we have things like osteoporosis that make things like hip fractures more prevalent. And after diagnosis with MS, 66% of people are able to maintain the ability to walk for 20 years after diagnosis. And it's all right, but PT can help lengthen your health span and the quality of your walking for each patient. So gait training in the clinic, we can use what's called functional electrical stimulation. And this is essentially using electricity on that anterior tibialis muscle that I was talking about earlier that helps you bring your toe up off the ground to prevent foot drop. That when you're at home, you have that strength and motor control to prevent foot drop that might cause you to fall. And we can do interventions like assisted devices. So many people think assisted devices are the end of the world, that if you get like a walker, a cane, or a forearm crutch, that MS is winning somehow. But it's actually not the case, because if we can improve your quality of life by giving you something to live how you want to live, some people maybe don't need an assisted device for every time they get out of bed, but they might want one to go to the grocery store for when they need to walk longer distances so they can live safely. We also have ankle foot orthoses. So these are plastic and carbon fiber orthotics that you can use that go around your ankle and foot, and that can stabilize the joint to improve your walking quality by improving your foot clearance off the ground and assisting foot range of motion. So if you have what we were talking about earlier, a contracture of your ankle, so your feet and your toes are stuck pointing towards the ground, and this can be really bad if you want to clear your foot, because part of a healthy gait cycle is bringing your toes up. So an AFO can help you with that range of motion, and it can also decrease the risk of falls by making the lower extremity more stable, because it's working as like your supplemental musculature to help you decrease the energy cost of walking. So in the acute stage of MS, it's important to see a physician to get treated for your lesion, and then immediately see a PT to preserve and ingrain functional movements to prevent secondary impairments like atrophy and degeneration of the motor control that we're talking about. And in chronic periods of maintenance, a physical therapist should be seen, like once a month to every 6 months. And this is to prevent any secondary impairments and to maintain impedance or maintain your independence throughout your lifespan, because MS is a very difficult diagnosis because depression is pretty poor in this population. I think half of all people with MS will be diagnosed with clinical depression, and what's even worse than that is suicide is over 7 times more likely in patients with multiple sclerosis. So I would suggest you see a psychologist or some health professional who's specialized in depression or mental health, alongside a physical therapist and a physician. Vitamin D and aerobic exercise have also been shown to improve cognitive function, which might help with depression You could also try sleeping 7 to 9 hours. That's what the CDC recommends for optimal brain health. Nutrition might help. Also, learning how to do activities of daily living, like transferring into and out of bed, getting in and out of the car, reaching for objects on your own independently. These are all things that can improve your independence and sense of self-efficacy. And then some things on spasticity that we were talking about earlier with the arm bending and the bicep and the tricep contracting at the same time. What's been good for that is, I guess, some physical therapy. We can do things in the clinic to improve your range of motion. But what's interesting, Jessica Rice did this study of 2 high-quality systematic reviews, and she concluded that in neurological disorders, reducing symptoms of patient spasticity and central pain in multiple sclerosis, found that complementary and alternative medicines, CAM, the intervention with MS was strongly associated to be successful was cannabinoids. So one of those is nabiximols, which is like an oral spray, or other extracts. So that's legal where you are. That's also a treatment option you could speak about with your healthcare provider. But we also have things like botulinum toxin, which I believe is from the blowfish. So this is, some people use it for to relax their muscles in their lips so that they get puffy lips. Some people do that with the plastic surgeon, but in patients with MS who have spasticity, you could actually inject botulinum toxin into the muscle that's spastic, and it causes it to relax. This is a very local, somewhat dangerous treatment. If it spreads to the body, it could be lethal, I believe, but it's an option for those with spasticity. There's also what's called a baclofen pump, and this stimulates your GABA receptors. And what GABA is an inhibitory neurotransmitter, so that if you are overactive, you're overcontracting, you can have a baclofen pump implanted inside of you. I know that's a little wild, but it's also an option for those with chronic spasticity that impedes their, quality of life. And I just wanted to provide those options to y'all as just a little education piece, because that's what my aim here is, to provide as much education as I can to people. And I appreciate your interest in health and science. Again, I'm Carter Gansky. I'm a student physical therapist, and this is not meant to be a replacement for a healthcare professional or provider. It's simply meant for educational purposes only. Thank you for your interest, and I'll see you all in the next one. Peace.